So get this.
Shoe says.
80%, you know, you think about people with like ankle problems or leg problems or back problems or knee problems, you think this is usually somebody who's older. 80% of people ages 21 and older suffer from some sort of foot problem.
Well, think of all the athletics they've been playing,
in particular,
too.
Yeah.
This might even be more interesting. Most people don't like to talk about what is ailing them, especially when it comes to their feet for some reason, until it's too late.
So we have an expert, podiatric, is that right, surgeon, Dr. Maasi Smith of Urban Health Initiatives, walked us through several conditions that may be causing your feet to hurt.
Oh
boy.
Everybody walk your body. Everybody walk your body.
Most days they get us where we're trying to go, but sadly our walk isn't always pleasant.
People don't think of the feet as important. The feet don't become important until they hurt.
Itch.
Make it fun.
Or even smell.
Odor is basically from excess moisture in the skin. Between the 2 feet, you have over 500,000 sweat glands. A lot of people don't realize the number is that high.
Or know that the foot produces a fluid that results in bacteria developing on the skin. That causes the odor.
It's been called many names. It's been Limburger cheese.
One Limburger cheese sandwich. One Limburger cheese coming up. Right. Limburger cheese.
It's been corn chips. One of the ways you combat that is just try to keep the skin clean and dry.
The doctor says you can also try using pads or inserts in your shoes made out of charcoal. That absorbs moisture. And another issue people have to contend with?
Fungus is an opportunistic organism. You know, some people get it, some people don't. It all depends on the structure of your nail as well. Fungus breeds in dark, moist areas.
Places like the inside of your shoes.
Usually turns the nails black, brown. I mean, it could be bacterial, it could be, which can cause a green tone to them. Athlete's foot is very prominent when somebody has nail fungus. And then sometimes they can have, and sometimes the fungus can smell too.
Smith suggests treating the condition with medications prescribed by a doctor, like Lamisil or other over-the-counter topical antifungal creams. But if the nail is really thick or showing signs of damage, it will sometimes require a more intense remedy, such as laser treatment. And then there are ingrown toenails, which surprisingly is very common, according to the podiatrist.
Some can be real moderate and some can be real severe. When that nail goes into the fold of the skin, what it does, it pushes up the flesh a little bit. It kind of causes an infection and usually has a little abscess there.
Or even an infection. While it is very prevalent, the doctor says it is also very easy to treat.
We just give a little local anesthetic, use special instrumentation, and just remove the nail. Typically, it doesn't cause a serious issue unless somebody ignores it for a long period of time.
Consider that a holiday treat from Chanel to your house.
I wish we could have said, you know, a warning if you're eating some eggs and sausage.
But 80% of people, you said it, Chanel, suffer from some kind of foot problem. At least you know there's help.
Do your toes bleed?
I haven't checked lately. But here's the problem, just like Dr. Maasi said, don't put it off.
Well, that makes sense.
Because he can fix most of it. You just got to get
your
there.
Socks, you know, start bleeding through your socks. It might be
Well, that's a tip right there. Thank you.
If you're in a little bit of pain, go to the doctor.
But that's true. A lot of people just say, oh, you know, you
It'll
just get
go
over
away.
it. Walk it off.
Bloody socks? Go see the doctor. There's your slogan for 2013. Hey.